What is used is the fine needle aspirate from the thyroid nodule. So, like I explained earlier, the first step is to perform an FNA, fine needle aspirate, and the pathologist look at it. At the same time, you can take another nodule aspiration and put it in a little vial that contains a solution that is optimized for nucleic acid stabilization and preservation. Then you send this vial to Enterprise Diagnostic, and from this single vial containing few cells, they can interrogate both DNA mutation, mRNA fusion transcript that are also oncogenic, and microRNA expression to get a better picture of what's going on in this nodule. It's one test, two answers, both on the positive side, the malignant side, and the benign side. Well, it's not going to keep the number growing, unfortunately, but it's going to optimize the way we manage patients right now. I'm not a treating physician, but I have the privilege to work with them for many years now, and that's why I was working so hard for many years to develop this test, because it's important to have both high sensitivity and specificity. Because again, what you want is you do not want to send the patient to unnecessary surgery. This is not good for the patient. This is high cost to the medical system. So what we have calculated and predicted, we are doing study to confirm that, is that with this new test, just by improving the sensitivity and specificity, we can reduce the number of unnecessary surgery by almost 2 to 3-fold relative to other molecular methods out there. So that's a significant improvement, because my mother, for example, is a patient right now, and if she can avoid the surgery, we are going to do it. Now, if we have molecular proof that it's a cancer, then of course she needs to go to surgery. So it's not a small decision, because it's not only the surgery. You can live without a thyroid. It's all the consequence, the potential for complication, the hormonal treatment that may be required after the surgery. It's a very streamlined, because now they don't have to send to one type of test and then look at the result, potentially send another one. You send it once and you get the result. The another advantage is that if you do a Diagnostic test, for example, first you detect a mutation, you don't need to do the second test for microRNA, because you already have identified something that is positive, that is likely to be associated with cancer. So you don't need to do a second test. So there is advantage in terms of cost and reimbursement. This test is the new test. It was launched 2 months ago. The validation study was published this week, so it's really brand new. It's the first microRNA-based test for thyroid cancer. So microRNA are a very short piece of RNA, 20 to 21 nucleotide long, that are key in gene expression regulation. And they are known for a very long time to be deregulated in cancer. It's just we are the first one to apply this technology to diagnosing thyroid cancer. The feedback from the community has been excellent. We have been working very closely with this community anyway for 3 years. It was an extensive piece of work. Thousands of samples were analyzed, both to develop this new method and then to validate it. So the reception has been very good, and based on the performance, it makes sense to replace, multiple tests that can either do rule in or rule out with a single test that can do both. So we'll see in a few years, but based on the science and the data, yes, I expect this test to be very successful. So that is the next step. Currently, the presence of a mutation is used mainly for diagnosis. Okay, positive, likely you need to go to surgery. Now there is other application, is that different type of mutation may be associated with different type of prognosis. Is the cancer more aggressive? Do I need a different type of surgery? Or do I need to complement the surgery by other type of secondary treatment? That's the next step. But as you get, you really need to have more and more data on a subset of different type of mutation to be able to make the right conclusion about the benefit of this type of analysis. So we are working on that, but it's going to take time if you want to do a real clinical validation. So we are continually improving this test. So the next step is to add mutation or fusion transcript that are known to be very specific to cancer. So we are going to continue to increase the sensitivity of the test without affecting its specificity. That's the first step. Second one is to look, like I said, to other applications, potentially not only diagnosis, but also prognosis.